I am Dr. Thompson, Akwo Ntuba, international politician, international physician, international communicator, certified professional and expert in global health, sub-specialized in global health communication and medical communication of Medcom. Mental health, mental health, mental health, mental health. There are many of you who are listening and hearing about mental health, and you are just there and saying that, oh, we are celebrating with all those who are celebrating with mental health. Now, mental health is a component of health in all the global nations that we work with. So today, let me take this as an opportunity to give you a bird's eye view of the work that Dr. Thompson, Akwo Ntuba, international physician and consultant, certified expert in global health, has been doing around the world. During medical school, we did community-based experiences and services work where part of our clerkship and community counseling had to do with mental health, behavioral health, stress, anxiety, depression, bipolar, schizophrenia, name them. And we call it the global health problem because mental health problems, some of the few that I've just enumerated, are found in all the countries of the world. And in medical school, we were trained in psychology, part of which was health psychology and abnormal psychology. Abnormal psychology deals with, behavioral health, mental health issues, substance abuse and addiction, recovery, depression, anxiety. For some of you, you don't even know because you are not physicians, you've never worked in the labor ward like me before and deliver women. We also have women who come with postpartum mental health issues. As a senior staff of physician in the teaching hospital, working in the psychiatry unit, part of our work was prescribing medication and other methods that are used to address mental health problems. As a leader of physicians, as the state elite's chairman for health, I was involved in policy issues, resource formation, human resources in healthcare, strengthening the healthcare system, looking at the mental health aspect of it. And as the chairman for health of the elites in the state, I work with the Prime Minister's office, the presidency, and the Vice Chancellor's office to make sure that there was a medical school in the university that produced physicians and other personnel in mental health care. With our work in infectious diseases, HIV/AIDS related mental health care issues, with our behavioral psychology of health, we have been involved in mental health prevention campaigns around the world. In Europe, in France, in Germany, in England, our work and our involvement and participations are there for you to see. In the United States, I've worked extensively in the recovery area, and I continue to do so. And I want to tell you that stigma is one of the issues that we are dealing with, but COVID itself shows the issue of minority health and health disparities and how they affect access. That is why insurance, health finance, and all of those things, health as a human right, as the Biden administration says, must come to the forefront so that universal health coverage based on primary care, that should have a package of mental health component in it, is actually assured the Americans. In my constant travel in America, meeting with health care personnel at county, cities, villages, town, and federal officials, we have addressed the global health aspect of mental health, working with counselors, pastors, and spiritual input in mental health has been done. But today, I want you to underscore the importance of mental health and the need for everybody to be able to access mental health. Because if everybody is not given the opportunity to access mental health, there will always be problems that we cannot manage, because some people are actually discriminated against, because insurance acquisition is made in a way that some people, especially minorities, Latinos, blacks, Pacific Islanders, Asians, Indian Americans, and a lot of minorities can't actually afford mental health care insurance. Health can only be universal. Everybody can access health care. We have issues of suicide, homicides, committing suicide by police, and all of the problems which are health related. And we are asking that even the police department continue to do its work on the basis of crisis. There are homeless people who have a lot of healthcare issues. There are people who are actually in the prison community. They are called the new asylum as it relates to mental health. There are lots of people who come out there because of their mental health problems. They shoot people. So there is a need for everybody to be able to access mental health. It has nothing to do with the down and rejected in America. It has nothing to do with the down and rejected in Europe, in Africa, Asia, South America. Name it. There is no one day for celebration of mental health work for us. For every day is the international